Namaste and good afternoon. Welcome to our Facebook Live session presented by Apollo Hospitals. This is Dr. Srinidhi Chidambaram, and I'm very happy to see you all again. Chronic obstructive pulmonary disease, or COPD, is a chronic inflammatory lung disease that causes obstructed airflow from the lungs and causes symptoms like breathing difficulty, cough, expectoration, as well as wheezing and other such complications. Emphysema and chronic bronchitis are the two most common conditions that contribute to COPD. Chronic bronchitis is the inflammation of the lining of the bronchial tubes, which carry air to and fro from the air sacs of the lungs, whereas emphysema is a condition in which the air sacs or the alveoli themselves are destroyed by many aspects. So COPD is a chronic condition, but today what we are going to discuss is what are called flare-ups or exacerbations that might happen to anybody who has been diagnosed with COPD. But this is something which is important to recognize, important to treat early, and we can also discuss if it can really be prevented, because a flare-up can make you sick. It can make you even feel so sick that you need to be hospitalized, and it can make your COPD more severe. So the fewer flare-ups we have, the better it is. So today, to discuss all about managing flare-ups in COPD, I am delighted and honored to welcome Dr. Nikhil Modi. Dr. Nikhil Modi is a senior consultant in the Department of Respiratory, Critical Care and Sleep Medicine at Indraprastha Apollo Hospitals, New Delhi. He has a vast experience in dealing with all types of respiratory ailments, including sleep disorders, with extensive exposure in fiber optic bronchoscopy and other chest-related procedures, and is experienced in managing all types of critically ill patients. He is on the Special Advisory Board of the Ministry of External Affairs for COVID-19, and he has been the recipient of the Young Clinician Award in the year 2022 and the Pulmonologist of the Year Award in 2019. Dr. Modi is a holder of the European Diploma in Adult Respiratory Medicine, holder of the Indian Diploma in Critical Care Medicine, Fellow American College of Chest Physicians, member of the National College of Chest Physicians, European Respiratory Society, Indian Society of Critical Care Medicine, and many more. He also extensively publishes in several national and international journals. Welcome, Dr. Modi, to this discussion today, and very happy to have you here with us to discuss about COPD as well as how to manage the flare-ups. So let's begin by asking you, what is COPD?
Yeah, thanks, Dr. Srinidhi, for the kind introduction. COPD, as you have already rightly said, it refers to chronic obstructive pulmonary disease. So, obstructive means that your windpipes are obstructed or narrowed down. Chronic means it is a persistent long-term problem, and it affects the lung tubes or the windpipes, which we call it. So, the pulmonary comes into the picture. Now, we all know lungs are an important organ because they help in gas exchange. So, the air we breathe in helps to give us oxygen, and we breathe out carbon dioxide. So, due to chronic obstructive pulmonary disease, these airways through the pipe through which the air goes into the lungs are destroyed. Even the areas in emphysema, what we call, the areas where gas exchange is occurring is destroyed, due to which patient find it difficult to breathe normally. So initial symptoms may start with a normal cough, which may worsen with time, and then exertional breathlessness, as initially it may be a partial damage. So on exertion or doing heavy work, a patient will feel breathless, which keeps on progressing, and patient later on, if the disease is not controlled on time, then they can have a breathing issues even at rest. So it's a vicious cycle, and due to the lack of oxygen, even other organs. So we call it a multi-organ disorder, because other organs, due to lack of oxygen, tends to get damaged with time.
Right. So what is a flare-up of a COPD?
When we talk about a flare-up, normally if we see a trend of COPD, it's a slowly progressive disease, and the most important risk factor which has always been there is smoking. And for past few years, the rise in air pollution, which we most of the time talk about in winters when the pollution levels are at the worst, at its peak. So even that has contributed to COPD cases in patients who have never smoked. So smoking and air pollution both are the contributory factor. Now, once they are exposed to that, their lungs start getting damaged. It's a slow progress of the disease in which, as I have said, that it starts from cough with mild exertional breathlessness, then progressing into a severe form. When we talk about flare-ups, we say a baseline breathing difficulty which a COPD patient has suddenly deteriorates due to many confounding factors. So these confounding factors which suddenly break the cycle and sudden deterioration in symptoms is there are most of the time either infection, change of weather. Sometimes patients are prone to allergy, and with change of weather, cold weather coming into the picture, even the pollens, dust, smoke, they on exposure to that, the flare up can occur. And COVID or viral infections are also an important factor. So sudden deterioration in symptoms which we see with these factors is called as flare.
So what happens in a flare-up? What are the kind of symptoms that one sees?
So as soon as the patient goes into a flare-up of COPD, the breathing becomes very bad suddenly. So patient who was able to do even routine activities normally, he was having just a breathing issues on climbing stairs or walking fast. During the flare-up, the breathing problem may be present even at rest. He may not be able to do regular routine activities. Cough can also increase. If there is an infection, along with the cough, there can be a sputum production which can be yellow or a dirty one. A fever can come into picture. So due to that, the patient day-to-day routine is hampered, and patient many a times has to be hospitalized for the management of this flare-up.
So what are the earliest, if somebody is diagnosed with COPD, what would be the earliest sign of flare-up that must make that person more alert and seek medical advice?
So a patient who is already a known COPD and is on treatment for that, so any change in any of your symptoms, that is whether only just an increase in cough you note, whether just an increase in your breathing you note, or you feel that you have developed some chest congestion also. So that is the time, if you just consult the doctor at that point of time, the flare-up can be prevented to go into a severe form, and then the things can be managed even at home. So any change in slight symptoms of cough, breathing, increase in production of sputum, or even a chest congestion, mild symptoms are like this, just be alarmed and just consult the doctor so that the things can be managed easily.
Is there any way in which this COPD flare-up can actually be prevented? Are there any aspects which can be controlled by the patient?
Yeah. So the first thing to control the COPD flare-up is to be regular with your treatment. Most of the time, what patients do when they have been started on some oral medication and inhalers for COPD, once they are well controlled on the medicine, they tend to become lax and they just forget taking about these medicines, or they feel that there is no need to take these medicines, and that is the time when it strikes the most and the flare-up is bound to increase to a significant fold. So please be regular with your medications. Please be in regular follow-up with your physician, because even sometimes with the medicine ongoing, your disease tends to progress. So if it is that, then on regular follow-ups, your physician can ascertain whether it is the course any action has to be taken or any increase in medication has to be there. So first is be regular with your medications and on with your follow-up. Second thing is you should be knowing that with the change of season, these things can increase. So whenever the season is changing, with upcoming of winters, with change in pollution level, the flare up can be more. So be cautious at that point of time. Consult your doctor, make changes necessary so that you don't land up with a flare up. Thirdly, if you are allergic to dust, pollens, so if you are going to an area where you feel you will be exposed to too much of smoke, dust, either avoid that or maybe you can wear a proper mask. Mask, I think now post-COVID, everybody has understood the importance of a mask. So if you're going to that area, even our exposure to dust and smoke is significantly reduced if you are wearing a mask. So keep a mask handy with you and wear that. Thirdly, there are some vaccines which are now available. So for infective exacerbations, a person who has already been diagnosed with a COPD, so we are recommending regular vaccination for these patients. One is the influenza vaccine. The second is the pneumococcal vaccine, which controls the bacteria, which is the most common cause of infective exacerbation in COPD. So we recommend vaccination for each and every COPD patient who comes to us because their exacerbations or flare-ups are significantly controlled on using these vaccines.
You were talking about infective exacerbations, doctor. So could you tell us a little more about how infections can cause these kind of flare-ups and how to prevent?
Yeah. For that, I would first like to tell how our normal airways function. Our normal airways have a cilia. There are small tentacle-like projections which are there in our normal mucosa, which tends to clear out all dust, all the bacteria which we inhale through the environment. And when a patient acquires a COPD due to smoking or pollution, these normal ciliary mechanisms are destroyed. There is excess of mucus production which occurs in our airways, due to which mucus becomes trapped. The normal mechanism of clearing of these bacteria and dirty particles is not there, which gets a good media to lie in the lungs itself. And these then continue to multiply and then they cause infective exacerbations of COPD.
So what are the common what are the common organisms that can cause these infections?
Any form of respiratory virus, whether it's a coronavirus, influenza virus, there are multiple, more than 50 different viruses which are common with change of season, which we call as seasonal flu, can lead to a COPD exacerbation. Apart from that, common bacteria are there. One is Streptococcus pneumoniae, some other bacteria which can colonize in the destroyed airways like Pseudomonas, E. coli, Klebsiella. So multiple bacterial organisms can cause this problem. Also, I would like to add, COPD patients are prone to acquire tuberculosis infection much more commonly as compared to a person who has a healthy lung. So even a tuberculosis infection or a fungal infection are more common in a COPD as compared to a healthy individual.
I can't help asking this question because there is a lot of air pollution now in some cities. So what would you advise a patient of COPD who lives in such a city where suddenly, due to seasonal and other factors, the pollution has increased, it has become, quite a severe category. What would you advise a patient who has COPD and who needs to go out and go and work, go out and live a normal life? What would be the advice that you would give?
Talk about pollution. In fact, I would like to say here that pollution has become a major culprit in patients acquiring COPD during their life. And the ones who have already acquired a COPD and also those who are still healthy, I would say this pollution right now, especially in the northern belt of India, is disastrous. So you need to be cautious. So what we are advising our patients of COPD is that avoid going out in this pollution. As much as please avoid going out in this pollution. If you have to go out, try to go in afternoon. When the sun is out, the chance of exposure to maximum pollution is minimum, because early morning and night, due to the cold weather being there, the smog is much more collected, and due to that, the exposure is quite high. So if you have to still go out in afternoon. If you are doing some exercises to help you, start doing them indoors. Don't do it outside. So, and if for any reason you have to go out, please wear a mask, because this is how you can protect yourself from this severe levels of air pollution right now.
Right. So coming back to the flare-up of COPD, when does it become like a life-threatening emergency?
COPD exacerbations when the breathing problem is so much that a patient can identify at home. If he is not able to speak words, he is getting breathless, that he has to pause after each word. That means it is a significant one. Nowadays, most of the patients are having oximeters at home. So if the oxygen level has started to go down, especially less than 90, that is an indicator that it's a severe thing. You need to report to an emergency immediately. And if the fever along with these problems is too high and the phlegm production is too high, then also report to the emergency on immediate basis. Sometimes patients during exacerbation may not be able to tell much, but the attendants or the patient's relative who are there with them, they may know that patient might be having some tremors along with the breathing issues. Patient, due to retention of carbon dioxide, that is the bad air we exhale out, start becoming drowsy, or they have irrelevant talking, then all these are indicators that patient is going into a severe flare-up. They need to report to the emergency on immediately.
Right. And also, does the COPD flare up? Does it also like actively increase the disease process itself? Does it cause more damage to the lungs?
Yes, definitely. On one hand, if we are using medication and inhalers properly, they slow down the disease progression. On the other hand, each and every flare up worsens the disease progression, you can say even 5 to 10 times. So a disease which was to progress over a year's time may progress within a week's time to that severity. So each and every flare up needs to be taken care of, needs to be prevented, I would say, because your disease is getting bad and bad after each and every flare up.
Also, you were talking about the caregivers, the family of a person with COPD. Now, you already mentioned what are the warning signs that they should be aware of and when to take medical help. Are there anything other factors that the family should support a person with COPD or monitor in terms of their own lifestyle? In terms of what they eat or how they exercise. So what is important from the lifestyle point of view for a COPD patient?
So basically, once a patient has become a COPD patient, the family roles comes into the picture, because most of the patients who have a COPD are smokers. And they come to us, they visit us once in a month or maybe 2 months, 3 months time. So we always tell them that you should stop smoking, but one time just telling them is not going to make them quit smoking. So it is the responsibility of the family members who are around them. They ensure that the patient stops smoking. Otherwise, the disease progression will not stop. Flares up will be much more. Second thing is, they need to maintain that patient takes a very balanced diet, which is rich in good amount of fruits and vegetables, other high protein rich, because that will build up their immunity. So a flare up due to an infective exacerbation may be minimized with that. A regular exercise regime, maybe some deep breathing exercise and some muscle building exercise which can help in breathing is important, and the family members can make sure that the patient is following that exercise regime, because doctor cannot be there all the time to reinforce these things. So it is the duty of family members that they make sure with that they will stay healthy, the stress on the family, the burden on the family itself will reduce. So they should take that into account and be alert about all these things whenever required.
Sure. Is it also that are COPD patients advised that if they have a flare-up, they should automatically, if they're using oxygen or an inhaler or any medicines, are there any kind of instructions which are given to them that before they seek medical advice, they have to do certain things by themselves?
So most of the time, a patient who has a COPD, whenever we prescribe medications to them, we prescribe them as and when needed medicines also, that are emergency medicines only. So we tell them if the patient is having an exacerbation, you can take this inhaler additionally with the normal routine medications you are taking. Especially if you check your oxygen is less and you have an oxygen backup at home, start the oxygen because that will reduce the work of breathing and patient will get time to seek medical help before the things can turn bad. Also, home-based nebulization has come in big time now. So people do keep nebulizers as backup. So because inhalers, what happens when you are in exacerbation, the coordination, the breath holding which is required with the inhaler is sometimes difficult. So backup nebulizers, we are advising our patient who we have seen have had frequent flare-ups in the past. So we can keep a backup of nebulizer so they can take the nebulizer immediately and that can give a significant relief, at least for the time till they can take a medical advice.
Right. Is there anything else that you'd like to add, Doctor, before we conclude the session?
So COPD, I think, is a big menace which we are facing right now. Smoking was the major thing in the past, but now with the rising air pollution, many of our COPD patients do not get history of smoking. And this is a disease which, if we timely identify and we timely control, nowadays medications are so good that you can have a very healthy lifestyle and good quality of life. So don't hesitate if you start having symptoms of cough, breathing, and consult a doctor on time. That will save your life, that will save agony of yourself as well as your family, and will go a long way in keeping you healthy and fit.
Thank you so much, Dr. Modi, for this wonderful discussion. So viewers, I do hope that you have understood now all not only about COPD, but also on how to manage your lifestyle with COPD and how to manage the flare-ups. No matter how careful you are, there will be the COPD acting up sooner or later. So it's very important to be aware of the warning signs, to be prepared, and ask your doctor to help you work out an action plan that what you must do if you have an exacerbation must be something that you know very well. And please remember that when you start feeling worse, it's very important to seek medical help immediately. For more such topics and to see our health information videos, please do subscribe to our YouTube channel. And please remember that we are present throughout the country, as well as on all the digital and social media channels to provide you with any assistance at any point of time. So till I see you the next time, take care, thank you, and namaste.